Good day, learners. I am your health teacher, Cherime Talisi. For today's lesson, we will learn you will understand the guidelines and criteria when selecting and evaluating of the health information and services, as well as when buying products. So first, I'm going to ask you with this question because being a consumer, we also need to consider these questions when you are making some decisions on buying products or availing services. So, where did you spend your money recently? What item did you buy and why? What kind of services did you last avail? Or who recently you have shared information or help information? So, I'm asking you with these questions because we will discuss about consumer health. So, consumer health also aims to develop a person's ability to evaluate and utilize health information, products, and services wisely and effectively. So, consumer health refers to the decision you make about purchase and use of health information, products, and services that will have direct affecting to your health or affect to your health. So, being a consumer, you also need to consider some points or some informations that what are the products that you need to buy. Is it beneficial to you or not? Or is it from the reliable sources or not? So consumer health, to identify about it, consumer health have three components. So the first component is the health information, which plays vital roles for us individual because uh, it is critical because it may be alter some decisions. For your decision, it can be alter some informations that people that you have received from, or the people that you have heard, the information that you have read or heard from the social media or from TV. So health information refer to the data and facts about health products and services you can get from the media and the people including professional agencies. So having this information or health information, we all need to know if this is from the reliable sources. So these people are the reliable sources of the health information, such as professionals, licensed people such as physicians, scientists, teachers. They are reliable sources because their information is based on research and studies, as well as the educational institutions. We get the right informations from them. They, they also get the right. They also need to get to give the right information. This this information that I will give you, this information that you have seen in the screen, is the information that I give you that we have encountered from the previous or from our past, from our parents and grandparents. Please study the information in the screen. What do you think is this information? For you to think if it is from reliable sources or not. Warts are contagious. Some people will always think that warts are very contagious, but according to the research, if not to skin contact, warts are not contagious. Then in the second sentence, most people are putting some toothpaste as a first aid for their burns, but according to the experts or the people who have studied it, toothpaste on burns causes irritations. The next, sleeping with wet hair causes mental disorder. So these are the beliefs that we get from our parents or the grandparents from our surroundings. But according to studies, these are not scientifically proven. Also, this one sleep need varies depending on the individual. So according to the study, we people we need to sleep 8 to 10 hours a day. So this information in the screen are the information we usually heard from the people or we heard from our neighbors. So we must know what are the information that the information we need to know from the reliable sources. So the next component is the health products. So the health products are the substances or material equipments prepared for us to buy. These health products are what we have consumed. So the health products we usually buy it in the market, in the store. So what makes us buy these products? So that will the health information comes in. So health information is very important because when you are purchasing these products, health information you always read and what information that in these products that you need to avail if it is harmless or harmful. Next one is the health services. So health services is the information or action or procedures or work performed to help satisfy your needs and wants as a consumer. So health services are often connected to the health care people. With these healthcare programs, they are aimed to appraise health conditions by giving examinations, cure, and treatments disorders. So, of course, these services, the health services, you can avail this one by the professionals. So, what are those professionals? So, these are the licensed people who are conducting these examinations. For example, dentist or doctor. These are people who are experts on their field to give you health services. You can just give. You cannot just go to the to us to dental. You can just go to a dental clinic when the doctor or the dentist is not licensed. You need to go to the dentist or nursing care that are licensed by the government or licensed by their professions. Next, I will tackle to you the guidelines on the purchases of goods and services. So, I first need to judge which product and services will be beneficial, harmful, or useless. So, this one, the health information that you have read, not just from your neighbors or from the your peers or your classmates that they have shared to you, that means that it's true. But then, based from what have we have discussed, judge products which are beneficial to you from the health information that you have read or you have get from the reliable source. Then next, know the local laws or regulation that protects consumers. So as a consumer, you also need to know what are your rights. Then locate dependable medical, dental, and nursing services. So So this one I have said, so you need to get the health professionals and they need to be licensed in order for them to give you good services. Then apply knowledge and required with respect to personal environmental health in the purchase of personal goods and services. So those stores or those stores that you will buy those products, you also need to know if that the source is also legal or comes from reliable sources. So these ones are from unreliable sources, health of informations. So from the customs and superstitions. So what I have discussed earlier. So what we have to from our grandparents or our parents, does that mean that's also true? But of course, some of some of us will do it because our parents told us to do it. But some superstitions may cause some harm to all of us. So we need also the information. We need also the reliable resources for our health. Then information based on ignorance and prejudice. So when you are making some statements or when you are making some informations to your colleagues or to your peers, so make sure that you have the right information and you have the right resources, not just because your neighbor or your classmates have good outcome of that product or have good outcome of that services, that means that it's right for you. Then commercialized health information. So you need to remember all of this. You need to remember all of this to get the right health information, right? Get the right health products and get the right services that you need. So as a consumer, we must know that we need to be educated and make a wise decision in making the products. So, for the activity for today, group into five, then ask each team member what they have done recently relating to our topic today. Then identify it's either a health information, a health product, or a health services. Also explain what they have made them to buy that product or choose the services, then choose a representative to present it to class. So that's all for today. See you next time.